Okay, we're now going to go to cluster C personality disorders. These are the anxious disorders, and there are three disorders here: avoidant, dependent, and obsessive compulsive personality disorder, otherwise known as OCPD, to distinguish it from OCD. Start with the avoidant. Person who feels inadequate, very sensitive to negative evaluation from others, feels extremely inhibited socially. They basically have social anxiety disorder to the nth degree. It's pervasive. It's been there since early adulthood or adolescence and continues. You just really think about it as somebody with generalized social anxiety and who learns to kind of avoid relationships as a result. Male to female ratios equal, interestingly. So they avoid occupational activities that involve interpersonal contact because of fears of rejection, don't want to get involved with people unless certain being liked. They're restrained in intimate relationships. They're really worried about rejection and criticism, inhibited in new social situations, etc. And I pretty much have talked about all of that. It's really an inherent personality trait of shyness. And sometimes children who are belittled, criticized, and rejected by parents who have low self-esteem end up developing this personality. So how do they present to us in the medical setting? Well, they don't go to a physician unless severely ill because they don't want to, they want to avoid any social contact, and they're worried the physician will criticize them or, why didn't you get your varicella vaccine? That kind of thing. They'll miss appointments. They'll make the appointment, but they really don't want to come. And if whatever symptom gets better, they'll just miss it and not call. Very importantly, they'll agree with everything you say, but they won't follow the medical advice. Why? Because they don't want to do everything you say, but they're not going to disagree with you because they don't want to get you angry or rejected. And if they perceive any subtle rejection or humiliation, they will never come back. Comorbidity is clearly, although number 3 on the list is social phobia, but they can have all of these other comorbidities as well. So social anxiety disorder is basically the same thing, except it's just very pervasive. It's in all social situations in patients with avoidant personality disorder. It's an interesting differential between schizoid personality disorder. Those are the ones who couldn't care less to be around another person. A patient with avoidant personality disorder really covets relationships, but just too scared to get involved. And they often do have relationships, but they're very insular, and the person's very reluctant to have any new type of relationship or take any risks in an intimate relationship. And then you have generalized anxiety, but these patients really lack anxiety if they're not in a social situation. Group therapy can be very helpful because it's basically exposing them in a safe environment to other people and their other people's attitudes about them. The cognitive distortions, when the patient feels like, oh, this person rejected me, well, an analysis of the situation can show the patient that no, they did not. Exposures, skills training, etc. And the medications are pretty much similar that you would for social anxiety disorder. Dependent personality disorder is the next one we're going to talk about. So this is a person who has an excessive need to be taken care of. They're clinging, they're often submissive, and there's constant fears of separation, much more common in women. Prevalence is considered through population studies to be lower than any other personality disorder, 0.5%. So here are the features: unable to make their own decisions, they need others to take care of everything, they're afraid of expressing disagreement because they'll lose the support of the significant other. They lack confidence to do anything out of the ordinary. They go to excessive lengths to get nurturance and support. They will even stay in a relationship even after, since it's mostly women, I'll say, even after the guy has done multiple things to show that he's not interested, or that he's barely interested, or that he's only interested for sex. The dependent person will just stick around just to get whatever the crumbs are that he's willing to give her. They cannot bear to be alone, and so they bounce from relationship to relationship if one ends. And they're They're worried about being left to care for themselves. So these are patients that are going to cling to their physicians. There's going to be frequent phone calls to get advice over the common cold or whatever else they're experiencing. They often will want their significant other to be in the examination room with them because they just don't trust their own abilities to convey what their symptoms are or to understand what the physician says. So they need somebody in the room with them. They need the kind of more paternal type of medicine where the doctor just tells them what to do because they can't make a joint decision. They really want the physician to make the decision about what to do when there are alternatives for treatment. These patients are also very susceptible to domestic violence, as you can imagine. They accept a lot of abuse. They're very reluctant to sever a relationship even after abuse. So etiology, again, there is a genetic link. Parents who are overprotective, which makes sense, can generate a child who feels like he or she just can't live on their own. It's not an enriched environment where a person has access to all kinds of stimulus. It's basically, there's not that much, they're not exposed to lots of new things so that they become scared of new things as they get older. Also, they may be medically ill in childhood and thereby develop a sense of weakness and dependency. I've listed here the comorbidity, and let me just show you a little video clip.
My sister suggested that I talk with you while I was here.
Why did you come to the emergency room this evening?
Oh, just an accident.
Excuse me?
An accident.
Uh-huh. A bruise, a cut? Did you fall?
A can opener, I guess.
You guess you got cut with a can opener?
Could my husband come in and talk with you? He knows all this a lot better than I do.
So you would feel more comfortable with him here in the room?
Yeah. Where is he? He is still here, isn't he?
Oh, yes, he's in the waiting room.
Can he come in?
Let's talk a few minutes first.
Well, I'd feel better if he were here.
You look frightened.
Well, no. I just need him here.
Well, I'll ask him to come in about 10 minutes. You said you cut your arm with a can opener?
Kind of.
What was happening at the time?
I was cooking dinner.
Was there anyone else there with you?
Just Larry,
Who's Larry?
my husband.
What was he doing?
Drinking, I guess.
Was he doing anything else?
Fussing.
What was he angry about?
The kids didn't rake the yard. I don't know.
And then what happened?
He threw things.
Did your husband throw the can opener?
Can Larry come in now?
What would that feel like, talking with him?
He can talk better than I can.
Did your husband cut your arm?
Oh, I don't think he really meant to.
Has he ever hurt you before?
He never really means it. It's just when he's drinking.
Have you ever thought about leaving your husband?
Oh, I could never do that. I couldn't live without him. He's really good to us.
And how is he good to you?
He drives me to the store, and he drives me to his parents, and he takes me to his wrestling matches. And
does he ever take you to visit your parents?
Well, he doesn't like to visit them very much. Has it been 10 minutes yet?
Almost. What things do you do without your husband?
Um, Most of the housework, I guess. He's just right there down the road if I need him.
Do you have your driver's license?
I have it, but I never use it. I'm just not very good. I'm out of practice. I think my husband drives better, and I like it when he drives.
Why do you feel better when he drives?
Um, he knows the roads better. I wouldn't be able to get around. I'd probably just get lost.
Have you ever gotten lost?
No.
How's your memory?
Um, it's fine, I guess.
Do you ever forget where you put things?
Um, Not usually. No, my memory's good. Um, I'm always having to help the children remember where they put things.
How old are your children?
8 and 9.
Have you ever had a job away from home, or have you ever thought about getting one?
Well, Larry's never said anything about it.
What do you think?
Well, I guess I could talk to Larry if you think I should.
Do you have any friends?
Yeah, there's Larry's brother and his wife, and Larry's cousin,
And do they live nearby?
about a mile or so away, I guess.
Do you have any neighbors?
Um, well, there's a family next door, but Larry doesn't like them too much, so we never see them.
Do you have any friends who are just friends?
What do you mean?
Do you have any friends other than Larry's friends?
My sister?
What did the two of you do together?
She likes to take me shopping or out to eat.
Where do you go?
Oh, just wherever she wants to go.
Do you ever suggest places where you want to go?
Oh, I'm not very good at that sort of thing.
Do you like the places your sister chooses?
Um, Not always.
Do you tell her?
No, never.
Why not?
I might make her angry. She might not want to go with me. Are you sure my husband hasn't left? Can he come in now?
Yes. Maybe it would be a good idea for me to talk to the two of you together.
What's interesting in the treatment of these patients is that if they're willing to go into therapy, they become extremely dependent on the therapist. And the therapist can use that dependency in a positive way by validating their experiences, improving their self-esteem, address their distortions that they can't do anything on their own, or that they ought to tolerate the abusive behavior of their partner. Therapists can promote independent behavior. And of course, there's always medication. Again, I wrote here Axis 1, but I mean medication for where they have social anxiety or generalized anxiety or depression. Medication can help as well. But the interesting thing is by pulling them away from, I think about them as like small planets revolving around a sun. And by pulling them away towards the therapist's gravitational pull, the therapist can then send them right back out from orbit around the therapist into the real universe where they can actually function like a normal person. So there's actually I've had very good success in treating patients with this disorder. Now, patients with obsessive compulsive personality disorder, this is different than OCD, primarily the concept of egosyntonic. Patients with obsessive compulsive personality disorder feel like Of course, all the towels should be straight and there should be symmetry everywhere and your place should be completely clean and piled, etc. Whereas a patient with OCD is distressed by their need to constantly create symmetry in their environment. So they're perfectionistic, they want control, they're inflexible. More commonly in males, you can see it's the range in the population 2 to 8%, preoccupied with details, rules, order. Sometimes the perfectionism leads to procrastination. They're excessively devoted to work at exclusion of leisure. They're overly conscientious and inflexible about morals and ethics. They often have trouble discarding worn-out objects and can be prone to hoarding. They insist that other people follow their way of doing things, and they're very frugal with money, and they're miserly towards self and others. They don't want to pay. I have a patient with this who's got like $5 million in the bank. He lives on $60,000 a year. He's a physician actually, so he makes like, I think around $600,000 a year. He lives on 1/10 of that and pile in all the rest of the money into the bank, but for what? He says, well, it's to retire, but it's just interesting how much he's depriving himself, and when he's dating someone, he also similarly does not want to spend excessive amounts of money on his date. So etiology, again, it's all in parenting and how the parents, what the parents disapprove of and what they approve of, can dictate how the child grows up and how the patient's interaction with the world is as an adult. Just like with narcissists, there can be midlife depressions when they've not recognized their life goals. Question for you is, which personalities do doctors mostly have? Which personality disorders? Obviously, it's OCPD is one of them, and what's the other most common personality disorders in physicians? Turns out it's narcissistic personality disorder. Many of you might have guessed that. Anyway, how do these patients present in the medical setting? They want extreme details, and they can drive a physician crazy. Often, they research things and they know more than you do about something. They readily spot mistakes or contradictions in what you've told them, and they're very judgmental of other people, including you as the physician. We talked about the difference between OCD and OCPD. And the psychotherapy focuses on helping them loosen up their perfectionism, let them experience emotions that they're currently suppressing, and let them experience some of their dependency needs so that they can just kind of open up and be much more flexible people. They have a better prognosis compared with patients with avoidant personality disorder. Okay, and here I've just done a matching question that you can look on your own with the answers. And that's it.